Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. In today's video we are going to be talking about pharmacology. Now I've had many different sessions on pharmacology, and I do that because pharmacology is such a big unit. Whether it be for dental hygiene students or dental assisting students, there's so much you have to learn, but everybody's first question is, what are the common medications? What medications do we have to know? So in this unit, I'm going to be talking about the medications specific to different types of agents and specific to different types of situations. So let's say your patient is on an anti-anxiety type of medication. So I will tell you the more common medication names for that. Now there's so many out there, so I can't tell you all of them. Depending on the practice you work, depending on the city you live in, you may see different names and you may not see the ones that I talk about today. But for the board exam, they like to stick to the more common ones. So even if you don't remember what the medication is used for, you might see the name and then be able to recognize it a little bit. And you might say to yourself, well, I know that's not an antifungal medication. It's either an anti-anxiety medication or is it for heartburn? You know, I can't really remember. So in today's video, I want to talk to you guys about the different categories and then some of the more common meds for that. So let me share my screen. So this is going to be not a long video today because I'm getting right to the point. And it's actually starting to get dark outside. So I did turn on some lights in my office here. I do try to do the videos during the day actually, because I just find it's just nicer to be able to see when it's not so dark outside. And then half the time, you guys can't see me too well anyway. The video quality is quite poor. So this will be the last video that I'll be doing today. But students did have questions about pharmacology drugs because the last pharmacology topic or session we had wasn't based on the drug specifically, but it was just pretty much pharmacology overall. So this is specific. It's about 10 slides. But yeah, so let's talk about it, and I hope that this helps you understand a little bit more the different categories and the types of drugs that go along with it. Okay, so can everybody see my screen okay? The first category I want to talk to you guys about is the antifungal agents. So your patients will be on this if they have some type of fungal infection. Now there are many different types out there. It doesn't mean they have it suddenly. It could mean that they've had this fungal infection for years. It doesn't mean anything overly serious like, oh my God, you have a fungal infection? Oh no, you know, nothing like that. Fungal infections are not contagious, but it could happen from many different forms. So the common one is if your patient is on antibiotics, especially if they have to take them often. If they had a toothache, for example, and they need to be on the antibiotics because they have an abscess and they didn't take them properly, so then they have to go on another set. Or let's say the first set didn't work, you know, they could develop a fungal infection, which is why in my office, if a patient has to go on antibiotics, we do typically say to take a probiotic with it. And even with probiotics, there's so many different kinds out there that we do tell them to go to the pharmacist. So when they're picking up their antibiotic, we ask them to ask the pharmacist what probiotic they think that they should take with that. And then that will just help to prevent, hopefully, a fungal infection. So it could happen even if the patient has xerostomia, if they wear dentures and they're not fitting properly, if they're not a healthy patient to begin with, it is very, very easy to get a fungal infection. But the most common medication, which I do hope all of you know this one, is nystatin. I'm not even going to try to pronounce these names here, but they could go under these names also. So for the board exam, yes, you have to know all of these names right here. But this is the most common antifungal agent. So when you see nystatin or any of these names here, think right away antifungal agent. Okay, next one. Antiviral agents. So students tend to get antifungal and antiviral mixed up. So antiviral are talking about hepatitis, hand, foot, and mouth, which is contagious, by the way, primary herpes simplex, recurrent herpes, herpes zoster, and HIV. Now, there are many different types of drugs you may be taking if you have HIV, and that's, we're not talking about that today specifically because that's a whole another lecture in itself. So if you are, or if you have HIV, think of your, I'm just going to make a note of this, retroviral drugs. So you will be on a series of these. So on the board exam, and I'm going to highlight this, if you see HIV or retroviral, think right away HIV. Your patient will have to take a series of these types when or if or whatever they have HIV, okay? Because HIV turns into AIDS, but if they're taking these type of drugs, it actually slows AIDS from happening. So does that make sense? So they have to be on a series of these so they don't get AIDS, because as soon as they get AIDS, AIDS isn't good, and then there you go, right? But for antiviral agents, this is the most common one right here. And I see this often if a patient has or did have hand, foot, and mouth. I had a patient actually get hand, foot, and mouth disease after they went to either Mexico or Florida. I'm sorry, I can't remember. And they went swimming, which we all would, but they had actually developed it from that. At least so they think, right? So he had to be on some hand, foot, and mouth drugs for at least a week or two, and he's contagious. So he actually had to cancel his cleaning and say, I can't come in. So he was on this type. Now there's many different types. I don't even think that this was the one that he was on, but this is the most common one and the one that you will see for the board exam, okay? Next one. Of course, we have your cardiovascular drugs. These are typically the most confusing for students because there's many different categories. So first, let's talk about the antiarrhythmic drugs. So if the patient's heart is either beating too fast or too slow, or it isn't beating consistently, so they will be on these antiarrhythmic drugs. The most common, which I'm hoping you all have heard of this at this point, is the Dilantin, of course, the most common. But then another category is your cardiac glycosides, okay? So this is when your patient could have congestive heart failure and or they could have an arrhythmia of some kind. And these are the common ones that that patient might be on. Now, I'm not going to try to pronounce all of the drugs, so keep that in mind. I'm horrible at things like that, and I don't want you guys to have to laugh too hard. So I'm not going to pronounce all of them, but that's why I have them in a PowerPoint right here for you, okay? Let me just move my video so you guys can see the bottom. Another category is the anti-anginal drugs. So everybody would have heard of this. This is the nitroglycerin. So if the patient has experienced angina, so that is when they feel like they're actually having a heart attack. So they feel like they're not able to breathe properly. They could be anxious and they're just not able to breathe properly, but they're actually having an anginal attack, not a heart attack, but it could lead to a heart attack. I know a lot of patients that have to carry around this nitroglycerin because if they have that sort of anginal attack, they need to have their nitroglycerin, or it could become worse and lead to a heart attack, okay? So this is something to always remember. And also remember that if they're taking, say, the nitroglycerin comes in either a spray or a pill form. Let's say they're taking a pill and they're having this type of attack. They put the pill under their tongue, wait 5 minutes, has to wait 5 minutes. If they still feel that, they take another pill under the tongue, wait 5 minutes. If they can still feel it, take one more pill, wait 5 minutes. But if those pills aren't helping after 5, 10, 15 minutes, call 911. They could be having a heart attack. Now, in the dental office, that's what we do. We don't call 911 right away because we find that typically for patients who may be having this type of attack, after the first pill, they feel completely okay. We won't continue with the appointment though. We will likely send them home and say to them, if you feel that again, call 911. Okay, so we don't always call 911 initially, but in the textbook, it does say that if your patient is having this attack, call 911 just in case. And that is probably a good idea, but it just sort of depends on what your protocols are at the office. But the key to remember is they can take a pill or a spray, wait 5 minutes. They can take that pill again or the spray, wait 5 minutes. Take the pill again or the spray, wait 5 minutes, but you can't give them any more, nor can they take any more. 5, 10, 15 minutes, that's it. If it didn't help, call 911. They could be having a heart attack. Okay, next category, antihypertensive, which is the most common, most popular. Oh my goodness, I swear every patient I see has high blood pressure. Honestly, it's so common. So the more common types are the angiotensin converting enzyme inhibitors, or this medication Lasix, okay? So there's different types of those antihypertensives. These are the more common ones. So that's why I just kind of made a note for you guys here. But there's so many different meds out there for high blood pressure. So this is something you need to look at, but these are just the more sort of common types, so that if you see, let's say, angiotensin converting enzyme inhibitors on the board exam and you say, what the heck is that for? You know it is an antihypertensive. So they're likely talking about high blood pressure. Okay, next category. So this one here. So this one, people tend to confuse as well because there are different types. So let me just talk about this. So the first type is the inhibitors, or the anti-inflammatory. So these are the common meds here, which again, I'm not going to try to pronounce, I'm sorry, but they are used in an inhaler, okay? So what these do is they actually stabilize the mast cells, release histamine, leukotrienes, and other inflammatory cells. So these are used as the inhaler. But on the opposite side of things, but they do kind of go hand in hand, you have the bronchodilators. So this is used to treat the acute bronchospasm. So again, these are the different types. And what this actually does is this helps to relax the smooth muscle of the airway. So how can I say this in a different way for you guys? When a patient's having that sort of asthma attack, you want their airway to open up, okay? So how that happens is with your bronchodilator, which is also called your inhaler, okay? So you have the bronchodilator, which is your inhaler. But at the same time as you want that those lungs to open up, there is some inflammation happening there. So they need to take something to help to take that down also. So simply opening up the airway is a good thing, but that's not solving the problem, because when they're having troubles, their airway is blocked, plus there's too much inflammation. So you do need both aspects of it. You need the bronchodilator and something with an anti-inflammatory. Does that make sense? Because this is something where a lot of students tend to get confused with, and they are specific on the board exam. So the both go hand in hand. And in the dental office, please tell your patients that if they use an inhaler, to rinse their mouth out with water afterwards, because it can cause cavities, because it tends to make the mouth quite dry in a sense, and it's just not a good thing to keep in there. So have them rinse their mouth with water, and then that just sort of helps everything. Plus it kind of has that taste to it, which isn't a nice thing to have inside the mouth anyway. So I hope everybody understands these ones here. A couple more slides to go. So we have the gastrointestinal drugs, many different categories here too. These are also very common, especially in your older patients. In your younger patients though, like early 20s, early 30s, I find Crohn's and ulcerative colitis are becoming more and more common, unfortunately, which is horrible because that would not be a nice thing to have, right? So the different categories are heartburn. You have the gastroesophageal reflux and peptic ulcer type. Again, here are the different types of medications. I'm not going to try to pronounce them for you because I will do a horrible job. But these ones help to neutralize stomach contents and reduce secretions, okay? But then on the other side of things, if the patient's having trouble with diarrhea, these are the different types of meds that they will likely be on. So remember, so on the board exam, let's say you see this one here, cimetidine, you know. Even if you have no idea what that is, having you look at these slides, you may say, okay, I remember that wasn't heartburn. It had nothing to do with Crohn's or ulcerative colitis. I can't remember. So it either has to do something with the diarrhea or the peptic ulcer maybe. So it does help to look through these slides because believe me, these meds are not English, you know, like they're just not easy to memorize. But try to just keep reading over them, reading over them, reading over them. So at the very least, if you see them on paper or on the computer, you have some sort of idea what it could be used for, okay? So the next one is, of course, Crohn's and ulcerative colitis. So this helps to increase resistance to infection and to assist in the wound healing. So they say people with Crohn's and ulcerative colitis is when they can't eat certain foods. Their stomach lining isn't as healthy as it should be. So foods actually make it a lot worse. Certain foods, there's actually holes and openings, they say, in their stomach lining, which would be horrible. So they have to be on a very strict diet so those holes and those openings don't become worse. So that would not be a nice thing to have, but I see a lot of patients have that. So it's a good thing to know. So they could be on some pretty hefty meds, these ones here, but that just sort of helps to keep things under control for them, because if things aren't under control, they would be using the washroom all the time. They would have issues. It's just not a nice thing to have. Okay, guys, so next one, the neurologic drugs. So they, these ones here, we're talking about seizures, Parkinson's, multiple sclerosis, and Alzheimer's. So this is common, you guys. As we get older, you will see a lot of patients on something like this. So you have different categories, of course. So you have the anticonvulsants, and these are the different types here. You have the anti-myasthenic, I'm sorry, I'm probably saying that wrong, has to do with muscle weakness. So notice how the different categories help with different things, but they're all under the same category. You have anti-Parkinsonism, which of course help to control tremors. Again, it's a different category. And then the antispastic, I hope I spelled that right, antispastic. So they help to control spasms. So different types for different areas under different categories. But notice all of the medications are something different. So you have to know all of this, especially for the board exam. For the real world, it's just something you learn over time because you will hear the patient say the same type of meds usually. So over time, you will be able to say, oh, this medication here, the ambientome, oh my gosh. See you guys, I'm horrible at this. Ambenotonium. Over time, you will know that that is used to help with muscle weakness. But for the board exam, you know, like you guys have to know so much stuff that it's all memorizing. But I'm sorry, you have to memorize this. Like even if you want to print out this PowerPoint for your records, it's only about 9 slides, and then just study them over and over again, and then eventually it will stick. It takes time. I always say it takes time because you know what, you guys, it doesn't happen overnight. Don't think that you will learn pharmacology overnight. It would be nice, but you won't. It takes weeks, it takes months, because pharmacology is a huge unit. So I hope at the very least that I am helping you. Okay guys, we have 2 more slides left. So we have the psychoactive drugs. So this is something different. The neurologic and psychoactive are different, but students tend to get them confused. So the psychoactive has to do with antidepressants, anti-anxiety, antipsychotic, and anti-manic drugs. So anti-manic is when you go like up or down. You are excited and then you're not excited. You are happy and then you're sad, you know, things like that. That was probably a horrible example, but I hope it made you laugh. So these are the different categories here. So the anti-anxiety involves these meds. Anti-anxiety is different, by the way, from antidepressants. You must know that. Antidepressants involve these drugs here. And everybody remember that this one here could be used to help quit smoking. So if a patient's on this, they may not be on it as an antidepressant, but they may be using it to help them stop smoking. So it does go hand in hand. Then you have the anti-manic and the bipolar, the you know, up and down. These meds here are the more common. Sorry guys, just changing my color for you. Let me move the video so you guys can see the bottom. And antipsychotic, to treat psychosis. So more memorizing, more things you have to know, but I hope that these slides help to kind of put everything together for you, because if you try to memorize all of the drugs in the textbook, you will go crazy, like paper over paper, saying, okay, well, this drug is with this category, but is used for this and this and that. So I hope that this makes it a lot easier for you. Last slide, and this one's an easy one, yay! You have the endocrine and hormonal drugs. So this is when the body has either too many hormones happening or not enough. There is insulin, which we all know insulin. Hopefully at this point you know what insulin is used for. And the estrogen and the progesterone. So the birth control pills, and it could also be used to relieve menopause. So these are the different categories, everybody, right from your textbook, okay? So it's right there. The resources for this PowerPoint is from actually the Modern Dental Assisting text and the Darby and Walsh Dental Hygiene. I can't remember the editions that I used, I apologize. I think the 9th edition for the Modern Dental Assisting, but I can't remember the Darby and Walsh. But I took them from those 2 textbooks. And this slide, yes, it's only 9 slides. This PowerPoint, sorry, is only 9 slides, but took me hours to prepare because I actually had to go through the categories. and the different types of meds, and then recheck the categories to make sure that I had the right spelling. So it took me some time. So I do hope this helps. This isn't all of pharmacology, but, oh, sorry, there's something popping up on my screen, isn't there? I just have to move my webcam again. Oh, no, there we go. It's gone. So I do hope this helped because it took me time to prepare. But do not think that this is all you have to know for pharmacology, because it's not. This is just kind of a recap on the different types of drugs for the different categories. So let's stop sharing my screen, and I will post this on YouTube right away for you guys. It is getting darker and darker by the minute. It gets darker a lot earlier now, so I hope that you could all see me okay. But I look okay in the webcam here, but hopefully it will upload okay. I will post this onto YouTube. Any questions, please just comment below in the YouTube video, and I'm happy to help always. But yeah, so I guess I'll just wait to see if there's any questions, and I will see you guys all soon. See you later.